you'd be surprised like how many people I've talked to in the last few months that they don't realize that low-level disinfection is not enough to protect their
Hmm.
patients. So
This month, we are placing the focus on patient safety awareness. And while ultrasound is generally considered a safe modality, that doesn't mean that it's exempt from the risk of becoming a vector of infection. One important step in keeping your transducer safe for use is through proper disinfection, which is why today we'll be focusing on what methods are at your disposal and how effective they are. Here to help us understand more about this important topic is Caroline Woodmansee. Caroline is a repeat guest. This is her second time appearing on the Scoop on Ultrasound. She is a clinical sales specialist at Parker Laboratories and has over 4 years of experience in the medical device industry. She is a clinician herself and occupational therapist by training, having spent over 9 years in practice. Caroline, thank you for being here.
thank you for having me.
So I think that for most clinicians, this is honestly not the most exciting topic, especially for ultrasound users. Healthcare providers really have a lot on their plate. That's the truth. And they already know it's important to keep patients safe. And they're aware of a lot of infection control protocols. So when this topic comes up yet again, I think it's easy to feel like, more protocols, more steps, what more is there to do, especially with ultrasound, which, like I said, really is generally considered a safe modality. But the reason we're having this discussion today is because there are actually new methods of ultrasound disinfection that are really worth exploring and bring new value to administrators and ultrasound users. Before we get into those new methods, though, could you walk us through what the traditional methods of disinfecting an ultrasound transducer are? What's being done today? What do clinicians already know?
Sure. So when it comes to levels of disinfection, let's kind of start there, and I'll explain low level disinfection versus intermediate level, and then high level disinfection, and then we also have sterilization. Okay, so
Right.
depending on what type of scan is being performed, that's when you're going to choose what level of disinfection you're going to take your device through. So, a non critical device, like you're doing an abdominal scan using a skin
Hmm.
surface transducer, um, if it's on intact skin, then you're going to clean the probe and put it through low level disinfection. All
Yeah.
right. And then if you have, say in the OBGYN space, if you're using an endocavity probe, a transvaginal probe or transrectal probe, that needs to be cleaned and then taken through high level disinfection.
Hmm.
Okay. And then you're getting into these critical devices and like the intraoperative probes, that's when they
Hmm.
need to be taken through sterilization. And
Exactly.
and then, traditionally with high level disinfection, you know, facilities are using these soaking methods. All
Hmm.
right. So usually post transvaginal scan, that probe is being soaked in chemicals to take it through high level disinfection. Whereas low level disinfection, they're traditionally being wiped down with a low level wipe.
Right, that could be a wipe or a spray, right, for the low-level disinfectant. I feel like that's what we see very often when it's not something like the soaking. Now, what are some of the risk or issues that can happen if the probe isn't properly disinfected? So if we don't maybe follow low level versus HLD, or if we just use a probe cover and kind of skip a step, what are the risks there?
Yeah, that's a great question. So if you're not doing the proper level of disinfection, then your patient is going to be exposed to any microorganisms that are left on that probe. Um, to kind of elaborate on this, I'll give the example of the transvaginal probe. All right. It's normally covered with it's a probe cover is put on the transvaginal probe. The scan's performed. With that probe cover, there's a chance of micro tears. There's always a chance
Mhm.
of the probe cover breaking during the scan. All right. So if the probe has not been properly disinfected, the patient's going to be exposed to pathogens that might be left over on the probe.
Mm,
And I'll give you an example of a transvaginal scan being performed. Right. So say there's a patient who has HPV. You might not know that patient has HPV, and that transvaginal scan is being performed. Post scan, if that probe is just being low level disinfected and not high level disinfected, that HPV, especially type 16 and 18, are not being killed. All
mm,
right. And
wow.
then that same probe that has not been properly disinfected is then being used on the next patient. So that probe is already contaminated, and then your next patient is going to be exposed to those potential pathogens.
Yeah, so there's a serious danger. There's a serious danger there. And when you give an example like that, I think that it really puts the spotlight on the crux of the issue, right? That
Right.
we just don't know, sometimes where the infection could lie. We might not know what the patient has. And if we don't take those steps, we really are putting the next patient at risk. And we can't predict whether a probe cover will break or not, for example. Like you said, there could be micro tears, and just that being a risk alone is sufficient to understand that it is really important, to follow the steps properly, because the low-level disinfection, of course, in that case, can't kill the HPV. Really great example. Now, let's go into the part that I'm sure a lot of the listeners and viewers want to hear, which is what
Okay.
are some of the novel methods that are being developed? Because we just talked about low-level disinfection, sprays, wipes. It's what a lot of ultrasound users already know. Then we have the soaking. So what's new? What more could be done?
Yeah. So at Parker Laboratories, we have a new intermediate level disinfectant, Trisol Duo, and then a high level disinfectant, Trisol ULT. Right. And they're
Mm,
both chlorine dioxide foam based. Right. So instead of the traditional soaking methods, where that probe is being placed in the chemicals and staying there for 7 minutes on up. All right. We brought Trisol into the market in October of last year,
mm,
and it's a chlorine dioxide foam that's spread on the probe. It's going to sit on that probe for 2 minutes. All right. So
sure.
you've got it spread on the probe. You're going to let it sit for 2 minutes, and then any residue left on the probe is going to be wiped off. And that takes you through a whole high level disinfection and reprocessing of the probe
Without having to soak it
without
at
having to
all.
soak
There's
it.
no soaking. Wow.
There's no
Yeah.
soaking. There's
Yeah.
no special ventilation that's needed. There's no capital equipment that
Uh,
has to be invested in. It's just the cost of the consumables when it comes to pricing. And for high level disinfection, you can go through a whole reprocessing around $3 per cycle.
wow, that's fantastic. So I assume that because I was going to ask you, like, what are some of the benefits of this? I assume then that time and cost are two big benefits, right?
Yep, correct. So as far as time goes, like I said, it's a 2 minute contact time, and you
Mm,
can perform the steps from beginning to end in under 3 minutes. So it's going to
wow.
be quicker turnaround for these
Yeah.
high volume clinics that aren't able to wait, 10 plus minutes to go on to the next patient. You're going to, be able to go from patient to patient and have that
Yeah.
quicker turnaround time. And again, it's no costly upfront investment. It's just the cost of the consumables to go through that high level disinfection.
Yeah, I can imagine, especially in a busy OBGYN setting, for example, which was the example you gave of the transvaginal exam, you might have a lot of patients lined up. And to have to leave the probe soaking there for 7 minutes or however long it is, bringing that down to 3 makes a difference, right?
Yeah, it makes a huge difference, and just getting out there and actually talking to these sonographers, um, that you know it's delaying their time to get from patient to patient, and then it's kind of throwing their whole day off. So to allow for that quicker turnaround is very, very important. And I'm also hearing, some of these private practices that aren't necessarily doing high level disinfection. That's one of the big reasons, for one, inconvenience. Two is investing in that costly capital equipment. They're not able
Right.
to. And then just not having the time to go through proper high level disinfection. So we tried to solve a lot of those pain points for these private practices.
Exactly, exactly. Because it really is a balance between, of course, the patient safety is so important. It's a big priority, but then efficiency is also a big concern.
Yeah.
So to be able to balance those really is the sweet spot, so to speak, for an efficient infection control solution like the one that you just mentioned. And it, of course, being compatible with ultrasound probes, right? I assume, of course, that this was designed to not damage sensitive probe equipment parts.
Yeah, correct. So chlorine dioxide, that's the base of Trisol Duo and Trisol ULT. Chlorine
Mhm.
dioxide is not only safe for the end user, so it's low hazardous,
Mm.
it's also safer on these expensive ultrasound probes. So it's not going to damage the lenses, the cords on the transducers. Over time, it's going to help you protect that expensive investment because these good ultrasound systems, they're extremely expensive. So
Very,
um,
yeah.
right, so chlorine dioxide, it's very safe for the user and it's safe on the probes.
No, that's great. No, that is a really big concern. When any disinfectant is selected, I know that there's a risk if it's not compatible of over time, especially damaging the probe, and that's really, really costly. In the end, to not instead of extending the lifespan of the probe, just making it much shorter, is a costly. It's a costly investment for smaller practices, but even larger facilities alike. So that's really great to hear. Now, are there any challenges or drawbacks to these new methods of disinfection? Because usually there's something like what are some of have you seen any resistance to that? Can you tell us just a little more?
Yeah, I think the lack of awareness that there are new methods out there, you know, healthcare workers just get used to, using the same old methods. It's human nature for us to not want to implement change. We get
Right,
comfortable with certain things, and it's the same thing in healthcare. You're used to using the same methods over and over and over. You have to be willing to trial new products, and listen to what's out there. And also what I've seen out in the field demonstrating Trisol Alt to some of these clinicians and infection prevention, they they see how user friendly it is, how easy it is to
mm,
use, and they it's almost like they don't believe that we have the
uh,
efficacy to back it, but we do.
mm,
Chlorine dioxide has been used for years and years. We
mm,
have the efficacy to back it. It is user friendly, but it's safe. It's going to kill those microorganisms and go through a full high level disinfection. So just keeping that open mind to trial these new
right,
products.
right. And for anything new, usually I feel like there is a learning curve. So, what sort of training or resources would healthcare staff need to have to implement new methods of ultrasound disinfection like this?
Yeah, I think them getting the documentation, the
Mm,
resources, like I said, efficacy. Like we have an efficacy summary that we send out
mm,
that shows them, hey, um, chlorine dioxide is going to kill this long list of microorganisms, and then showing them the compatibility summaries, that this product is safe to use on your
right.
ultrasound probe and is
Mm-hmm.
validated and backed by these leading ultrasound manufacturers. And as far as you know training for the end user, we provide all that. We have an online training portal. We have all the resources that they need. And we also have a digital traceability app that
Oh,
the
that's
end
great.
users can use to keep track of their high level disinfection cycles.
Well, that's great. I mean, those are great tools really to have at your disposal, especially when we're talking about patient safety awareness and just making sure, that in every setting, clinicians are aware just of how much they could do, to keep patients safer. Now, when it comes to the machinery itself, I know we talked a little bit about how the wrong disinfectant can damage the ultrasound transducer. So, can these new methods that we're having a discussion on impact the lifespan of the transducer in a positive way?
Absolutely. As I mentioned before, chlorine dioxide, it targets the microorganisms. All right.
Mm,
So it's targeting those microorganisms, killing those off. It's not going to damage your probes over time. Especially we hear about damage to the lens on these probes
yeah.
using some of the soaking methods with these harsh chemicals, not
Mm,
only from the end users, the clinicians, the sonographers, the physicians who are using these harsher chemicals, but also from the ultrasound manufacturers.
yeah.
We're hearing about the damage that's occurring to these probes over time, whereas Tristel ULT, which is a chlorine dioxide based disinfectant, is not going to do that. So it's going to be protective of that
Mm,
costly investment of your ultrasound probes.
no, yeah. Now, when you look to the future, looking ahead, what would you say that the future holds for ultrasound disinfection? Are there other advanced methods in development or things that you think we can even improve upon what we have now?
And I think right now, there's a lot out there that clinicians can use to perform proper disinfection
Mm,
and and make their ultrasound probes safe for the patient. I think it's bringing awareness out into the
mm,
field. So educating not only the sonographers but also the leadership of these practices that might not even know that these endocavity probes need high level disinfection.
right.
You'd be surprised like how many people I've talked to in the last few months that they don't realize that low level disinfection is not enough to protect their
Mm,
patients. So I think education, training, more research can be done at showing clinicians the risk that they're putting their patients in by skipping some of these steps.
yeah.
So doing that research, doing that education, and then I also think, you know, strong statements being made by these leading organizations like AIUM and
Mm,
SMFM
mhm.
to make these statements to kind of help lead that education and awareness into the field.
And it's important to continue to shine a light on the conversation of ultrasound infection control. Because like you said, I think it's just so easy. You hear it often how, well, this is just how we've done it all these years. We disinfect with this or this method. And it just makes it easy to fall into sort of the same practice and not look to even improve upon that. And there is room to improve. And there is an active fight against healthcare associated infections, especially not just in the hospital. It's in other facilities too. So I think what you say of creating more awareness really is something key that has to continue. But with new products like this, I think it opens the door for facilities to be able to hit that sweet spot between efficiency and advancing infection control.
Yep,
Yeah.
you're right.
Yeah. Well, thank you, Caroline, again. I mean, it's been a great discussion, and I think this is something valuable for all the clinicians watching this to just be able to understand it more and look into the methods which you talked about.
Thank you, Emmanuel. It was a pleasure, and I look forward to us continuing this conversation.